back. It's still the Daybreak Show on Rock City 101.9 FM, the midweek edition of the show. Today, Wednesday, 31st of May 2017. Like I mentioned earlier on the Citizens Forum this morning, we'll be bringing a searchlight on the health sector in Ogun State in our bid to assess the performance and, of course, administration of the Senator Amosun led government in Ogun State. You want to look at it from 2011 to 2015, that's 4 years, and of course from 2015 till this very moment in 2017, that's another 2 years in the second term of 4 years. So you're looking at 6 years of implementing policies and programs, especially in the health sector. Many of you would recall the many promises made by the administration or made by the incumbent governor as regards healthcare delivery, qualitative healthcare delivery, the issue of free healthcare for children under the ages of 5, and of course pregnant women and those above the age of 65. You also recall the promise of health insurance for patients in Ogun State, or for almost everyone who can actually afford it or who needs this insurance. The NHIS, of course, has always come with its own challenges, with Nigerians complaining about the efficiency of that particular health insurance policy and scheme. How have we fared in our own health insurance scheme in Ogun State? You have so many programs, the BA program, you have the Araya program. How well has the government been able to implement these policies? How far have they gone in making sure that those who are actually in this net or that should normally benefit from this free healthcare have been able to do so? The free malaria program that of course makes people who suffer malaria and approach government hospitals get access to the drugs, and of course a free mosquito net, and get this particular drugs free of charge without any bottleneck at the different health institutions that we have in Ogun State. And of course the very bold and courageous move by the current Commissioner for Health, Dr. Ipaye, to rid the state of medical quackery. So many health clinics and institutions that are not duly registered, and the state has begun a campaign to actually close many of them down if they cannot get their papers and of course go through a due process. We will be looking at all this this morning in the eyes of medical professionals that have joined me in the studio this morning. And of course, Aghemerio is here. Aghemerio. We have in the studio two healthcare professionals, like I mentioned earlier. First, on my right is Comrade Nurse Roseline Solarin. She is the chairman, National Association of Nigerian Nurses and Midwives in Ogun State. You're welcome, Nurse Solarin.
Thank you very much.
Thank you for joining us. And of course, on my left is Dr. Adewunmi Alayaki, the former NMA Chairman, that's the Nigerian Medical Association, Ogun State chapter. And of course, the immediate General Secretary of the NMA, talking about the national NMA now. Dr. Alayaki, you're welcome to the Daybreak Show.
Yeah, thank you, and good morning, listeners at home.
All right. First, before we go straight into this assessment and analysis, let me find out from you, Dr. Alayaki. Do you still work with government?
Yes, I work with government.
You work with government. With the state government or the federal government?
With the state government.
With the state government,
yeah.
Good. Commissioner Larry, do you work with the state government?
Yes, I do. I work with the state government.
Good. So that means both of you will be able to give us on-the-spot assessment and, of course, tell us as it is things that are going on in health institutions in the state. Let me start with you, Nurse Solarin. When it comes to infrastructure, the necessary equipment, facilities that normally should be the norm in a state that prides itself as the gateway state, and should set the pace, set a standard when it comes to efficient, qualitative, or quality healthcare delivery. How would you rate Ogun State?
If I were to rate Ogun State today with infrastructure and other things like equipment, I'll just give them 40%.
40%.
Yeah.
Would there be? Are you being fair enough?
I think I am.
How do you mean? Why are you giving Ogun State 40%?
Because there are so many dilapidated buildings in our hospitals today. There are some hospitals you will enter that you will feel sorry that you're there. We know that the government is trying their best, but the slogan we're hearing is that there's no money, and so it's only just a little that they can do. I know they have done some, like at OUTH, they've done some repairs. Like
That's where you work?
That's where I work.
Okay.
When this government came to power, we have about 3 buildings about to collapse in the hospital. More importantly, the toilets that the patients were using. And immediately, the state government rose into action and those toilets were repaired. But then we still have a whole ward now that is about to collapse completely. It's already sinking.
And there are patients who...
No. We have evacuated patients.
The patients.
Yes, we have evacuated the patient from that ward right now to another place. But if that place has been able to put in place, it will give room for more patients, to come in, and it will bring a lot of revenue, even for the government. I'm quite aware that in some local government centers, there are some new structures that were constructed there. But then, the old ones that we have, like the Hospitals Management Board, if you go to Ewekoro now, there are some building there that's on the verge of collapsing. If you go to Waterside, you will see the same thing. In fact, some of them, the roof has been cutted away, and they have to match the patients, in order to continue this job. We're not saying the government is not doing anything at all, but then, they still need to do more, for it to be very visible and for everybody to enjoy, in what they're doing.
Now, some people may argue that, well, it is not buildings and structures that do the work of of healthcare delivery. Sometimes the building might be rough, might be bad, but there might be very sophisticated equipment, expensive ones, that actually do the job. Would you say that these health institutions do have this equipment?
No, we don't have enough. We don't have enough equipment in our hospitals. Even where we do, some of them are obsolete. Everything is changing worldwide now. There are some new technologies that are coming up that makes the work easier, but we still don't have them in our hospitals today. We still have some hospitals where they are sharing ordinary sphygmomanometer, between 2 wards. It's as bad as that. So we don't have enough instruments. I know we have sphygmomanometer. That's what we use to measure the blood pressure of patients.
Are you kidding me?
We were trained to improvise, if you don't have what you need to do. So we are trying. Yeah. The one I mentioned is just one of the basic things, that are supposed to be in place in the hospital. But there are some other, major ones. If they are not available, there's nothing we can do. We have to refer the patients to where they are available, to a bigger hospitals. Sometimes we refer them even outside the state. No. A government hospital will not refer to a private hospital. We look for a better um, government hospital that is more equipped than what we have. We refer them.
But what if it is a private hospital that has the necessary equipment? Will it be out of place for you to refer?
Private hospitals cannot be richer than the government.
Okay, I hope so. Now, let me come to Dr. Alayaki. Dr. Alayaki, from what Solarin has said, that it's a bit disturbing.
Yeah.
But let me find out from you your own assessment of what exactly is on ground. First, let's start with infrastructure, equipment, and of course, personnel and welfare.
Yeah, thank you very much. I want to let listeners at home know that what we have on ground is nothing to write home about. When you look at where we're coming from, where we are, and where we hope to be in the next few years. When you say you go to a government hospital where you don't have basic infrastructure, basic facilities to work with, it's appalling. And we're talking about patronage or what have you. Patients will come, the basic thing you're supposed to use on them you don't have. Some doctors will have to come to the hospital with a sphygmomanometer with their own things they want to use on patients. Just because they want the system to work. And it's so appalling. And aside from that one, they come to the hospital, like Shirley said, even equipment that are supposed to be used, we don't have that, you now have to refer. You are losing patients, you are losing revenue, because not that you cannot handle those patients, but because you don't have what to be used on them, you have to refer them. And we have said, if you know you cannot afford it, can't you go into private-public partnership? Let some companies who can afford, to bring this thing, will generate personnel for you, patients for you, will give you infrastructure, bring those equipments, and let's have a sharing formula. Because we are going to give you the patients that are good, they're going to, for example, in the whole state, there's no place where we have MRI. And I inquired, I asked, they sell it for about 290 million. How much is that one? Even if it's in one facility, you can imagine referral from all state hospitals in this state.
Hold on, Dr. Laki. And that's what you don't have an MRI machine at OU. A teaching hospital?
Yeah.
Okay.
So you can imagine the number of patients that will be sent, that are going to be sent to such center, even if you have only one. Unfortunately, we don't have at all. So from Ogun State, we refer to Lagos. And you can imagine, what it takes. No, if you have, you can imagine how much you'll be making, and you're having a sharing formula, whether 50-50, 60-70, 60-40 or 70-30. We are making money. It is not your own headache to maintain such a machine. It is the people who brought in the machine that will maintain, they will put their own personnel there, all the accessories are going to be there. These are the things we are talking about. We know government alone cannot fund it, but we must make the system work. But in the case in which we care less about it, it means the citizens are going to suffer. Yeah. Don't let me go into that. Don't let me go into that. Because when you talk about efforts, you people have reported when we stage, this a work. NMA stage a work. I'm sure now we've written series of letters that let us just hear us out. And if you look at the last time the NMA had a rally that we went to Amosun, we had about 16 points or what have you, and there we chronicled, what has been happening in this state and what have you. And to today, it has not been addressed. So we had made series of efforts, several efforts to ensure that we put things in the right perspective. Children are brought to the hospital to be treated for malaria. They don't have, the drugs are not there. If they are there, certain points, maybe you have to refer them to go and buy somewhere or what have you. And these are the things, and we are talking about quackery. Now you come to the hospital, the government hospital, you cannot assess and you cannot afford what you came there to do. Then you have to go to somewhere else. If you go to a private hospital, it's far, they cannot afford it. So they have to go to a place where, they have access to the personnel there, though the person may be a quack, maybe anything, and it's very, very cheap. At the end of the day, the life, and the health of that person is in danger. But if government put in place, go to lawsuits. I was at Benue State University Teaching Hospital. I was amazed with what I saw there. And this university teaching hospital took note of almost 20 years after OUTH took off. So when you look at what we have on ground, then where are we? And our state hospitals too, when you look at it, even if it's just JAE, I say, okay, let us upgrade this JAE to a status that, you know, can be a referral from, I mean, a referral point for other state hospitals or general hospitals in the Ogun State, and put everything there. If you refer there and you put the right personnel and they are well motivated, then citizens will get what they're supposed to get.
I remember, good you mentioned a general hospital. I know that some time ago, the state government made mention of that possibility of upgrading it into a model hospital. What would you say stalled that implementation?
I don't know what stopped it.
Is it that place is too small?
Let me just tell you, whether it is too small, it is not too small. After all, where we use as FMC today was formerly a state hospital, where they were having medicine and pediatrics, and there was surgery and obs and gynae. Before we took over that place, you can go and look at what we have there now. Are you getting my point? Even that place, yes, if that place is not even big enough, just stand. You can even get a land and say, okay, this is A.
After it's government.
Just stand. After it's government, you can assess land anyway. So I don't know what stopped it. But I know that at times government will be making a policy and some people somewhere will be making a counter policy to make sure that something does not work out. I don't know about that. So what stalled it, whether it is money or no money, it depends on your priority. The Abuja Declaration says that 15% of our annual budget should be, targeted at health. But how much do we budget for health? There was a seminar I went to where the Kepiton was telling us that we should, even if 300 million is budgeted for health, let the 300 million be released for health. But in the case you budget 3 billion for health, and you have a partial sum of just 20 million being released, and other things will be on paper, past, that has been done. So when you look at it, it means a lot of things are going wrong. Just understand. Even the little amount, the little percentage that are being budgeted for health, do we have implementation of that percentage? So these are the things we are looking at. I may not know what is going on there. I work in the field. I don't work in the ministry, and neither am I working with of you. But when you look at it, that okay, you read this something. Oh, this is beautiful if it's implemented. 2, 3 months, 5 months, 6 months, 12 months into that year, and nothing has been done. We have to ask ourselves several questions.
The money is voted only in paper.
What is stopping it? There's no way, union and government. At times you jojo, at times you war. Yeah. Are you getting my point? You cannot say yes. If you jojo all the time, there are at times, the citizens' health is going to be in jeopardy. So at times you have to say no, put your feet down. We need this, this one should be done, put in place. And that is what has been going on. All stakeholders in the health sector have been talking about we must have this, and it's not been done. And you see, what is so disheartening is that people are now saying we supported this government because they promised us this, and we are not achieving any. It's not just at the state level. At the national level, it's happening there. Yeah. I was involved in drafting, how to implement this 1% consolidated revenue for NHIs of, NHA, National Health Act. I drafted the initial something in my hotel room in Abuja before the committee met. Till today, nothing has been done about it. If you read NHA, National Health Act, you will see that if that thing is implemented, we want to take care of the health of the citizens of this country at the national, state, and local government. But somebody somewhere is sitting at the top of it that is not seeing the light of the day. So we have to really say, and this is why people should come out and talk about it, that the health of the people is the health of the nation. If people are sick, the country will be sick. But in the case in which you are not doing the right thing at the right time, then what do we expect?
Now, okay.
It depends on your priority. It depends. We were taught in school about scale of preference. Are you getting my point? It's not about health. If you lose a life today, it's 100% loss to the family. Any other thing can wait. No, I'm coming. No, if there is flooding now, just my point. Maybe a section or what have you. You can still get your food elsewhere. I'm not talking about, but once a life is lost, it's 100%. You cannot go to Shakmo and buy another life and put into that person. So when you're talking about health, I'm not saying that you bring everything and invest in health, but something must be done. You understand that the people of this state, of this country, in terms of their health, they will enjoy it and it's affordable and accessible.
Now, let me quickly take you through an argument the Honorable Commissioner for Health put forward when we were talking about and not paying the necessary attention and preference to the health sector. And he said that billions actually go into the health sector, but many people don't see it because it has to do with recurrent expenditure, personnel costs. Can you give us a general overview, or maybe figures, if you have them at your fingertips, of how many health professionals are being paid or that are on the payroll of the state government?
Well, I may not have the statistics here now,
Okay.
so I never need to be asked. But when you look at a case in which all the state hospitals we have, all the general hospitals we have in this state, we have less than 150 doctors manning them.
Less than 150.
150 manning them. Then it becomes something else. When you look at the 5 state hospitals we have in this state, how many consultants do we have? Surgeons, obstetricians and gynecologists, pediatricians, physicians that are manning them. The works are being done by medical officers. Medical officers are supposed to be under the tutelage of some consultants, and they are now the alpha and omega. Then what do you expect? Are you getting my point? That's why I say you have to prioritize. In a case in which we are talking about, yes, we are paying them millions or we are paying them billions. If you don't have basic things to work with and you are paying them what, it will still come to nothing. Understand? It's about investment. We know that health sector, we are not supposed to really make so much money from there. But if you invest rightly, you still make more money. It can be very cheap, but the traffic, the moment that will be coming there, you'll be making your money. If I'm doing my MRI for 65,000 naira and somebody is doing MRI for 40,000 naira, and I'm having over 200 people patronizing me daily, and this person is having just only 10 people patronizing the person daily, just my point, this person will make more money. So that's what we're talking about. If you have basic things that we need, people will come. And they access it, they go. They come, they go. You will make enough money. Just so you don't need to make it so expensive. So when it comes to that, I won't lie to you, we are not there. We are not there.
All right, I want us to quickly address the issue of quackery. There are so many Illyrium, so many mushroom health institutions that people now go to deliver their babies. Some even fail to register duly for antenatal, especially our pregnant women, and just because maybe they don't even have necessary information about what is available at the state hospitals, and then they just go there, the lives are lost. Sometimes they lose both the mother and the baby, and then that goes on. What are you doing as an association to complement the efforts of government to reach the state of this?
Thank you very much.
Nationally.
Excuse me. Quackery is like cancer hitting deep into the bones of the people in this state now. And then when you look at what is happening in Lagos State, we are having the spillover in Ogun State. Lagos State has some programs on ground in which they are trying to rid the state of quackery. So because of the proximity of Lagos State to Ogun State, many of them are now migrating to Ogun State. And then, we have laws. There are several laws, but who is going to enforce it? That is the problem. That is the number one thing. So everybody feels that they're above the law. They can do what they like. Quackery, there are so many factors that are responsible for that. Maybe the people that are supposed to be doing what is right are not doing what they're supposed to do.
Who are supposed to ensure, who are supposed to give licenses for building of a clinic, of a maternity hospital, or whatever it is?
It is the state government.
Through the Ministry of Health.
Through the Ministry of Health. Then they are supposed to work hand in hand with all the professionals that will be there. Because each professional has a practicing license.
Okay.
So if you don't have a valid practicing license, you cannot work there. So we ensure that we renew our licenses from time to time. So if the Ministry of Health is working with all the professionals and they are moving around, they will be able to rid the state of quackery. But they are trying, because we have decided to work with the Ministry of Health, Dr. Babatunde Ikpaye. We were moving around for revalidation and to ensure that we track down the quacks in practice. But the efforts, they are trying, but it's not enough. It's not enough. What we really need to do is that any one court should be made to face the law. But that has not been the practice.
It's not just close the place.
It's not just close the place. The moment you leave, after some time, they will go and reopen the place and continue to practice. And they'll be looking out for you, for the car that you used to bring when you're coming. So when they sight it, they just lock the place up. So that is not enough. We have to put proper law on ground. Those who are training these quacks, they should be put to book. They should face the law. It is wrong. We have people that are supposed to train these specialist groups. So if anybody is just coming up with, okay, I'm training nurses, I'm training doctors and things like that. We have seen a case where somebody that was sent out of the medical school decided to set up a place, a big place, beautiful house, you know, with sophisticated equipment. The people that are coming in there will never know that this person is not certified to practice. So we have a lot to do. The Ministry of Health has a lot to do. The regulating body of these professionals too, like for the nurses now, the Nursing and Midwifery Council, they have put a committee in place that are supposed to move around with, you know, they have to work hand in hand with the Ministry of Health and ensure that this thing is done once and for all.
All right, if you're just joining us, it's Citizens Forum on Daybreak Show this beautiful Wednesday morning. And this morning, we are continuing our assessment of the 6 years of the Bikule-led administration in Ogun State and focusing on health sector. We have in the studio Comrade Roseline Solarin, the chairman of the National Association of Nigerian Nurses and Midwives in Ogun State, and of course, Dr. Adewunmi Alayaki, the former NMA chairman in Ogun State and the immediate national general secretary of the NMA in the studio. When we go on this short break for the national news and come back, both of them will still be here in the studio. And you'll also have the opportunity to participate. Stay with us, we'll be back. You're welcome back. It's still Citizens Forum on the Daybreak Show this beautiful Wednesday morning. We're looking at the health sector in our continuous assessment of the Senator Bikule Amosun administration in Ogun State. So many issues to look at in the health sector. We have two professionals in the studio. Comrade Roseline Solarin is the chairman of the National Association of Nigerian Nurses and Midwives in Ogun State. And we also have Dr. Adewunmi Alayaki, the former NMA chairman in Ogun State and the immediate national general secretary of the NMA. Comrade Alayaki, before we went to that break, we were talking about personnel, talking about funding and issues concerning providing healthcare delivery, efficient one. One key campaign promise of Senator Bikule Amosun, I recall, in 2011 and also in 2015 is affordable or free healthcare, rather, for children below the age of 5 and of course pregnant women and those who are above the age of 65. What's your assessment of that free health policy?
Well, thank you very much.
In the first instance, let me ask you, is it existent or non-existent?
Well, thank you very much. It is not in existence. The unfortunate thing is that maybe while the campaign was going on, there wasn't any proper assessment of what to be met on ground. And, this change mantra, everybody was saying, okay, if we are coming with this beautiful program, we'll key into it, and people keyed into it. Unfortunately, when this government came into being or into power, maybe they now reassess the whole thing and say, oh, till now, you've not been able to take off, you've not been able to do it. The child is brought to the hospital, paper whites, fever, or what have you, and they're expecting that, oh no, they said we're going to have a free treatment, it's not there. Mothers, who are pregnant, mothers or what have you, they've been coming and you have to pay. If you don't pay, you cannot have your CS done, you cannot have your normal delivery, you have to pay or what have you. So, and for the elderly too. So I believe that there was no proper assessment before that slogan, free health too, under 5, pregnant women and elderly. Till 6 years into this, what have you, we don't have it on ground. And we are hoping that before the end of the tenure of Senator Bikule Amosun, even if it is just for 2 months, let people feel it, that yes, I promised you this, and you can just have a feel of it. But as we speak now, it has not really taken off. And there are other things too that, it's so depressing that 6 years into it. That's why I said the other time that in times of priority, if you have said, okay, the Abuja declaration of 15% of the total budget should be, allocated to health, maybe it would have been easier for us to take off. But if it's not there, we are having is 3.16%, 3 point something percent, there's no, it cannot really fund that particular project. Well, it depends on the way you are looking at it. To some people, if you come to the hospital and you are being given a bill of 3,000, it is quite cheap to them. That no, 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 this is too cheap for me. Are you sure this drug you're going to give to me will cure me of this ailment? But to some people, 300 naira is so much that if you give them a bill of 300 naira, they will still contest it. That is too expensive. So it depends on how you're looking at it. But what we're saying in general, that at least let it be about 75%, acceptable and affordable to the general populace. That I come to the hospital, this is what I brought to the hospital, and after I've been given a bill, I can afford it. And if you cannot afford it, somebody is paying for it from somewhere. That is why you say you have free. No, there's no free something anywhere in the whole world. Somebody is paying for it. And that is why we've been advocating, we've been saying, let NHIS do the work for us, because it's a function of number. You understand? If you have over 1 million people paying to it and what have you, somebody will come, I don't need to pay. My pastor in the church recently traveled abroad and he had an MRI done, and he told me that the MRI cost $600. You can imagine, translate that one to Naira, you see how much that will cost. But he didn't pay a couple because somebody paid for it. So this is what we're talking about. And that's why we say, even if you cannot, government alone cannot fund health. You can have a PPP and tell them we don't want it to be expensive. If you have an MRI and it's being charged 40,000 naira in Ogun State today, it's a function of number. And you have over 200 people coming to have MRI done weekly. You're making your money. But if it is left to private practitioners, I won't lie to you, they will make you dry. Or even the private practitioners are bringing it, but you tell them, I'm supplying you patients. I've given you a place where to put your MRI. Supply personnel and bring your equipment. And you cannot charge more than this. And we have a sharing formula. It will still fly. People will still come. They will access it, you understand, and it's affordable to them. Are you getting what I'm trying to say now? So these are the things we are talking about. We have to go back and look at the policy we have on ground. How it's going to affect citizens positively. That when they dip their hands into their pockets, they make money. And we should reduce this out-of-pocket payment. That's what we're talking about. Let's NHIS. Recently, 2 weeks ago, I was in Abuja for one leadership retreat where the executive director of NHIS was there. And he spoke about, his disappointment about what has been happening in the NHIS sector. But we don't want to talk about that one. It's because, this we are talking about corruption. People forget that, one money that's meant for the populace, somebody somewhere is sitting at top of it and people are dying because of that one. Their blood will be on their heads. You understand? But we have to put up a policy that will help the common man on the streets of Nigeria.
Okay, that brings us to the issue of the insurance health policy of Ogun State. I know that they lost an insurance scheme. How would you rate? Let me start with you, Solarin. How would you assess that insurance policy?
Well, thank you very much. I think they have just started doing the registration and things like that, but it has not actually come into practice fully. They are working on it, but I don't know. I pray that the Lord will help us, because an average Nigerian is a poor person. 80% of Nigerians are poor now, so they cannot really afford even good food, talk less of buying drugs or taking care of themselves. So if we have NHIS like Dr. Alayaki has just mentioned, it will go a long way in helping us. They are a Araya scheme too. We have to start from somewhere. That's why they are trying to bring that one up. So let's wait and see what will come out of it. But what I know for now is that it has not actually, come into practice fully. But they have started the registration, those who will be eligible and things like that.
Okay, but that reminds me. I know that people have complained a lot about when they go to state hospitals, they are asked to buy drugs and then they go to the pharmacy of the hospital and the drugs are not available, and then they are referred to private pharmacy, or they are asked to go somewhere to get the drugs. Why is this so?
Well, the reason is that we don't have enough supply of drugs in the hospital, the essential ones. So if a patient is sick and the patient requires a particular drug to be treated, what we are after as healthcare practitioners is to have all the necessary things that we need for the treatment of that patient. So if it is not available, we have no option than to ask the patient to produce it. And it is what they bring that we're going to give. So that is the issue. That's where the issue of these fake drugs and all these things comes in. Because if you ask them to go and get a particular drug from a pharmacy store, they will just look at their pulse. There are different brands there. So they look for the cheapest. And the cheapest might not be the best for that patient. You may have to use it on, and the patient will not get cured in time. And the blame will still fall back on the healthcare practitioner. So it will be nice if the government can provide enough drugs for us in all of these health facilities, so the patient would not need to be going outside, even if they have to pay. If they are paying for original and they know that after using it for some days, they will get cured, it is better. But the drugs are not there. Okay, thank you very much. When I mentioned 4,000 nurses and midwives, I'm not really limiting it to the state government alone. It has, yes, what I'm talking about is the number of nurses we need to work effectively well in Ogun State, whether you're working with the federal or you're working with the state. We don't have enough hands anywhere, both at the state hospital and the federal health institutions. What people don't realize is this: the standard practice is supposed to be a nurse to 4 patients. And when you talk of a nurse to 4 patients, that does not mean one nurse for the 24 hours. We are running shift. A nurse will be there for 4 patients for morning shift, afternoon, night. That means for that 4 patients, 3 nurses are there. Then you also need to consider the fact that some will be off duty, some may be on leave, some may be sick, some may be in in-service training. So you have to make necessary provisions for all this, for effective, treatments for the patients. You need to have enough personnel. If you overwork yourself, you cannot give in your best. At times you'll be tired. What we have on ground now is where you have a nurse to about 20 patients. How do you want that nurse to give her best in that situation? There are some critical patients that need more attention. In fact, if you have to go by WHO standard, if you have a premature baby, one premature baby, 2 nurses are supposed to nurse that premature baby at once. For a full-term baby, of course, a nurse will be there. If you have a sick baby in the hospital, there are so many things that we need to do as a professional. So if you don't have enough personnel, it's going to affect the quality of job that you're going to do, because it's just the little that you can do that you will do. You will not want to kill yourself. If you die, what the government will do, they will only say that they should buy coffin of 20,000, and that's the end. Nobody is praying for that.
To buttress our points, I want us to look at this scenario. You might think that health personnel were selfish, but it is in the interest of the common man. For example, as a doctor, I'm consulting. By the time you want to spend about 30 minutes on each patient, for you to have a full clicking, you examine, you do what I do, 30 minutes. And now, after the 10th or 15th patient, you get your carrying capacity. That's the whole truth. Subsequent patients coming in, you cannot give in the best. Likewise for a nurse, likewise for the pharmacist, likewise for the laboratory experts. Just there's no way. And by the time you look at the patients that you still want to see, about 150 patients waiting to see you, to consult you. By the time you divide your time, you cannot give the best. You give a shoddy, clicking, you just click, you rush, a lot of things are going to be left unasked for. And the patient will go halfway. It has not been attended to fully. So that's what we are saying. If you have, even if you have the best equipment, I don't have personnel, to still be the same thing. If you have the best you have enough personnel, no equipment, it's still the same thing. So that's why I've been talking about prioritizing our task. If you want to do it, let us do it. If you don't want to do it, let us leave it. Let us call in stakeholders. You understand my point? The issue of NHS we are talking about, I think government cannot do it alone. Call in relevant stakeholders to join this ARIA program. Involve AGPMPM people, involve the doctors, the nurses who are going to work on, who are going to, implement what we have on ground. It's not about government just want to do it. Bureaucracy will not allow it to fly, because some people will just sit down somewhere pushing files or what have you. But when you have other people, private practitioners or what have you, and they come on board, you'll be able to draw something and drive the projects. And I don't know you have it. So that is why we are talking about, the health sector. We need to look into it. And when we look into it, we need to give the best, because the common man on the streets who cannot afford a meal per day, good meal per day, doctors are having 3 square meal. You are now sick, you now want to understand. And a lot of people are dying every day. And like I said the other time, if you give the best to our public hospitals, it's going to reduce quackery.
Exactly.
I won't lie to you. It's because they see that when you go to this Mama Lagbo, or you go to this person who is not, it's something is so cheap, or our own is so cheap, I can afford it. When I get there with 300 naira, the chemist will just count this and this for me. You understand? But if governments, have everything in place. Besides, from what I've just said now, you have not heard the best from the doctor, from the nurse, from the nurses, from the pharmacist. The patient is not getting well. The next thing is, okay, I've learned that this man can give me this agbo or what have you. Yeah. But if you have everything in place, you have gone to the hospital, everything that are needed, you get them, and you get well. You have no business visiting someone that will give you agbo at the end of the day. So government needs to look in that direction and see how are we going to give the best to the common man. I mean, when you look at what I'm saying, to the common man, forget about those that are rich or who are rich. I'm talking of the common man. Like she said, we have about 80% people who are poor in this country, cannot afford 3 square meal. People that you see that are putting on good dresses or what have you, they may not really have what the wherewithal to take care of their heads. And government really needs to do it. Briefly talk about on each issue. The first caller who talked about taking accident victims to hospital Jai. The first 2 at night, and because there was no payment, advance payment, they didn't treat the patient. Well, I think currently, I don't know when those things happened. Any accident victims taken to any hospital, be it government, be it private, should be attended to. That is the latest now. But that time that it happened, at times it will be who's going to pay for. The person who brought could not advance any payments, and at the end of the day, the government will frown at you that the money should be recouped. But now, what is the order of the day is that take any patients to any hospital, they are going to be attended to. I'm so surprised, and it's so disheartening to hear that the last person died after the person was taken to FMC. I think at times, let me just tell us the truth. We are not born equal. Some people, when they work, they put human face in their work. Some, they don't put human face. The truth must be told. You meet some people and they will put in all their best. But some people, they will just, nonchalant attitude, be doctor, nurses, pharmacists, it cuts across. You understand? There's no way you will not see such a person. But we pray that God, anytime I will need help, somebody that will help me should just arise at that point in time. But currently, if it happens, personally, I've called the head of Ijaye on 2 or 3 occasions that something like this happened. What happened? They investigated and it got back to me that that's not what happened. This is what happened. This is what happened. That's my point. At times you may need to get to the head of your hospital that look, we brought the patients all the time, and you'll be able to explain to us. And that is why we have we have this suggestion box here and there, and you can approach the head of your hospital, because the person, and we talked about the other time, that when you have a person who has been working and so tired of what have you, that I know if I tell this patient I cannot give the best at all, this patient will die in my hand, will previously could refer. But when you talk to the head of the hospital, you want to know. So I want to tell you that, okay, in these issues, I don't know when you took the patients to that place. Then on Mr. Nyambode, that essential drugs in our hospital, yes, we don't have. And it's so bad that we don't have. And I've been saying it. We pray that one day, an important personnel will come on an emergency, and maybe what you need to give is this to save the life of the person. Between the time they will go and buy from outside and come back, something untoward will not happen, and people will start shouting. we need to have our essential drugs in the hospital. We need to have our emergency drugs in the hospital. At any point in time, you give somebody is bleeding heavily and you really need to do something about that patient and you cannot find it. You cannot use whatever you have at that point in time. You just need to put something there. And those things are not there. They have to travel miles to go and get it. And when they're coming back, they have bought the cheapest one that cannot be, that you cannot use. But you have nothing. That's what they can afford. And they bring it. Eventually, if the patient dies, they put the blame at you, at your doorstep. So that one too is there. Now, the question of strike, that why only on salary, that what have you. If you look at, for example, now, since the NMA Ogun State came on board about almost 2 years, we've been trying to interface with government. We have written series of letters. As we speak, as I speak with you now, we are yet to have, that come and meet with us. When that thing failed, then there will be staged a protest that we want to meet with the governor. Unfortunately, we did not see him. And the SSG promised us that, okay, within 6 weeks, now after the government must have come back, they will call us. Now, almost 3 months into it, we are yet to hear from the government. And when you look at that, like you are stretched to the limit. And I said we gave us about 16-point agenda, out of which remuneration is just one of it. But when you now go on strike, what they will tell you, they keep on hammering on the remuneration aspect. Talking about infrastructure, talking about employment, talking about house officers, talking about any other thing, talking about civil autonomy, they will not talk about them. They will talk like you have gone on strike because of remuneration. That's, it is propaganda. You have other issues. And they believe that this is what is going on, what have you. For example, now, we are not even talking about remuneration. We are talking about put on the necessary things that will make us function well, employ more personnel, and those are the things we are pushing for now. But when it happens, they will say they are going on strike because of remuneration. It is not so. Then that government, where government priority, that misplaced priority. Well, it's good that people are talking about it, and I've said it at different fora. Until we wake up, until people wake up. In France, doctors or what have you, they don't want to. People outside decided to wake up and say, if you are not going to do this for health, this is what we are going to do. So people should know that, look, this thing you are doing, please give us this, give us this. We are the people who voted you in. But if people are just there, they're not saying anything, then you now leave it to the union to now say we want to fight. And when you are fighting, they say what they're fighting for is remuneration. But if people who are not receiving salary from government should rise up today and say what you are doing is wrong, do this, and maybe government will listen. Then they said we will ask for wrong thing. We are not asking for wrong thing. People have been asking for facilities. Ever since we've been talking here, we never spoke about remuneration. We've been speaking about, that we are not having enough personnel, we are not having good facilities, we are not having enough drugs or whatever. That's what we're talking about. We've not mentioned anything about money issue here. So when you look at it, it's not that we are asking for wrong things. But when you are stretched to the limits and now declare a strike action that maybe they will listen, they will use that what they're asking for is money. Whereas it is not. We have other things that we are asking for. So people should rise up. Then Mr. Adewunmi, you said your scorecard is about 2. How many extra do we have in the state as counting machine generator? We've talked about it. If government cannot provide, let us go to private public partnership where people will bring in modern equipment, and you tell them we'll generate a number of patients for you, and this will be the China formula. The beautiful thing is that when they supply their equipment, the personnel and the accessories, that machine will not break down. But if it's government that purchases the machine, protocol, bureaucracy, when you have a problem, for you to fix those problems, for the next 2-3 months, the machine will not function. But if I know that if this machine breaks down, it's going to affect what I'm going to get at the end of the day or what have you, then I'll make sure that machine functions. So it even pays us better that we have private-public partnership. That, okay, bring it in, operate it, and this is what you'll be paying to the government. And we'll just be giving you patients. Then we went to an hospital, you met a group of nurses talking. I want to assure you, it would be wrong for anybody talking during official hour. You may not know what they were talking about. The senior officer may be there to give warning to what have you, or to give instructions. But you thought maybe they were using it to discuss. It's not possible. Because we have this organogram of what have you. The senior ones will come and gather them together and be giving them instruction. But coming in and you think they were not giving you, their time at that point in time. During official hour, they will not do it. Number one. Number two, those people you saw, maybe they have even finished their own shift. They've closed for the day, and they are not doing everything. Other group of nurses who are supposed to be working are working. So You never can tell because you didn't ask them. You just saw them discussing and you thought what they were discussing was, sure, so my point. That's just it. So you not talk about doctors, they are enemies of, they are not. They are not. This is when, like, when we staged the rally, enemy staged the rally, what was the people's reaction? People did not say, these people are staging a rally now. Can you please answer them? What are people doing? They are not doing anything about it. They are so complacent. Now, if they're not straight to the limits and they're not trying to go on strike, you now say, oh, they're asking for money, they're asking for money. When you're supposed to speak out and you can say things objectively, what these people are asking for, they are very germane and important. Governments interface with them, come to the roundtable discussion and have a meeting point. What will people be doing? No, you are not doing anything. So please, they are not your enemies. People should be able to rise up to the occasion at the right time to defend what we have in our hands. Thank you.
Thank you very much. Let me add a word or two to what Dr. Alayaki has just mentioned. The first person that called said no deposit, no treatment. Well, to the best of my knowledge, what operates in most of our hospitals now, we don't reject any patient. Any patient that comes in, you still take in the patient, you assess, you look at what you can do. If you have what it takes to take care of that patient, you continue the treatment. If you don't have, then you refer immediately. That's what we do. It is not right for anybody to say because you do not have the deposit, there will not be any treatment. I know of what happens at OUTH. We always have emergency pack. There's no patient that comes into the hospital that they will not be attended to. So, well, if just like Dr. Alayaki has just mentioned, if there are issues like that, I think it has been corrected. You will not find such things again in any of our hospitals. Then somebody asked that why going on strike on salaries alone and not on essential drugs. I want to tell you, nobody will go on strike just because of salaries. There are other issues that will accompany that of the salary. But at the same time, I want to say this. The health workers are also human beings. They need money to take care of their family. If you are not okay yourself, you cannot care for another person. If you have ill health, you are not healthy. Psychologically, physically, socially, you are not okay. How will you take care of your patient? So it is also essential that anybody that works must receive their salaries as at when due. So that one too is also very essential. But more importantly, we don't go on strike on salaries alone. Then somebody mentioned that what are we giving back to support the community? That nurses' reaction to patients is not good and things like that. I want to tell you that we are giving a lot back to the community. Presently, our nurses are in the market now, educating the masses on what they need to do to prevent some, them contacting some diseases. So we are giving back in terms of education, in terms of services, all this we are giving back to the community. Then that the attitude, well, some people, in those days, they have already registered a lot of things in their mind. That when you get to the hospitals, the nurses are always nasty and things like that. But I want to tell you, it is not like that these days. No nurse will be so aggressive with a patient except there's an underlying, problem there. So I want to say that nurses are friendly, and nursing is purely caring for the people, and we do care for our patients. Then I think that's about all.
That's about all right.
Yeah.
Let's just wrap it up with messages and tweets if you have any. We have some messages. Yeah, Joel Ajisha first says there is a misplaced priority of Governor Amosun's project. How many roads were constructed in the revenue basket of Ogun State in Adewunmi and local government area? All the roads in this area are all in deplorable states. It's unfortunate. The government is busy building infrastructure in Abeokuta that contributes less or nothing to the economy of the state at the expense of Adewunmi and local government. It is unfortunate, and this is a wake-up call for the Yewa wanting to rise come 2019 election to produce the next governor of the state. Well, Joel Addition first opinion. And this one says, greetings to our guests in the studio, especially our dear beloved Dr. Alayaki. The masses will continue to patronize your so-called quacks because the government is not doing the needful. A situation where there are no equipment and drugs in government hospitals and an average Nigerian could not afford private hospitals. So what do you expect? May God save us all. That's Olayemi Adewunmi from Okejibo. This other one says it's high time the state government shifts its attention to do the needful in the health sector. Human lives should be given optimum priority, and all what is required should be provided to be able to achieve the desired result. The NHIS are performing tremendously well in the state, but not all are attuned to such a gesture. That's Cosmos from Goshen Estate. It is true that our hospitals and healthcare facilities are not in the best condition, and like the guests in the studio are saying, dilapidated structures all over the place, inadequate manpower, inadequate facilities, and so on. However, I think the panel of discussants in the studio um, is not balanced, as there is nobody from the Ministry of Health. I know that 15.105 billion naira was allocated to the health sector in the 2017 budget. Is it that somebody is diverting funds budgeted for the health sector? Is it the case that the personnel cost in the health sector is too high? Although it is Ismail. Good morning, Rock City. These politicians are all wayo and graduate people. No matter the sacrifice done by health and education sectors, it is not appreciated by government. God's government will come soon. That's Kade from Rwanda. Let me appeal to Governor Amosun to please use the same effort he has put on road construction, on healthcare delivery, which is in comatose. Pastor Shalaf Makinde from Owu Kingdom sent in that message. Our health sector in Ogun State is in a churlish and ungracious state because the present government is running on a dizzy policy. Abdul Gafar Lamine sent in that one, and only one doctor attends to both in and outpatient in the Lagos State Hospital. The drugs are purchased outside, lab tests are done outside. It's that bad. And Mr. S. Ladipo.
Can I respond to that because I work in a lab?
Okay.
Well, that's what I say at times they give wrong information to people.
Yes.
Yesterday I was at the hospital. The chairman of Aghemerio was at the hospital, Dr. Laduni, and Dr. Lotu were all there. We attended. I ran a clinic and they ran a clinic. Today I'm supposed to be at the theater to operate patients, so it's a lie. Our laboratory is functioning very well. The pharmacy is functioning very well. Just only those we buy from outside are the ones, and then maybe we don't have. Secondly, at times when you give them, they say it is too expensive. They believe you can source it from outside, and you go and buy a fake one at a cheaper rate. So that one they gave a wrong information about what was happening in our.
Okay. All right. The trees. All right, because of our time. Anyway, that's our show this morning. We appreciate every one of you who participated. Those who just listen quietly wherever they are. Thank you. Join us again tomorrow as we start the show as early as 7 a.m. Thank you very much, Ms. Solarin, for coming to the studio. Dr. Alayaki,
Thank you
for finding time. We appreciate both of you. And so to do your bits and to make sure that the good people of Ogun State enjoy quality and, of course, affordable healthcare. I am Tobi Joseph. Have a wonderful day.